one of the things I wanted us to cover is a little bit the definition of integrative medicine.
Okay.
And especially integrative medicine in cancer care. So we know in our background and what we do on a daily basis, we apply the best of medicine, the best of science, the state-of-the-art cancer therapies.
Yeah.
But in an environment and a setting where other complementary approaches are brought in under medical supervision and in a healing environment.
Right.
So all these concepts of bridging all these things together,
Right.
and everything that will help the patient heal. And every person heals in different ways. I think it's so important that as physicians, number one, we share with our colleagues that other modalities work very well when we bring them in a medical setting. And then we share with those who are out there doing only natural therapies and doing alternative therapies that don't believe in medicine, that that's really not correct.
Right.
That anyone who has cancer needs to apply and trust and know that medicine and science has great tools that help a lot of people do well.
Right.
And that they should look into it. And we see people who have advanced cancer and out of fear or whatever reason, they don't want medicine. They're doing other things until the cancer gets out of hand, then they come in and we work with them receiving a customized medical treatment, but we also support their beliefs.
Right.
So I think one of the messages we want to bring out to the community is the importance of bridging all these wisdoms together, the wisdom of medicine, science, the wisdom of the different complementary approaches, the wisdom of supporting patients' spirit,
Right.
their beliefs, and what they know is going to help them, and doing all this in a healing environment, in an optimal healing environment under the supervision of outstanding nurses, outstanding healthcare practitioners and physicians.
Right.
So I know this is something you've been studying and experiencing for a long time.
Yeah, I think the biggest mistake that we make in medicine is that if we don't know how something works, we feel it's valueless.
Mm-hmm.
And I remember when I was early on in practice, years ago in the 70s, you know, there were people talking about exercise. And doctor says, no, you don't have to exercise. You know, just do everything in moderation. You know, that's the best way to go. And then there was a Dr. Cooper who studied exercise physiology, an MD. I think he was from Texas. And now he proves exercise works.
Right.
But people knew exercise worked, but doctors really didn't support it. But now it has to be proven before doctors could buy it. And I'm saying whatever works, whatever you believe could work, has a very good chance of working. And people say, well, that's placebo effect. Well, I have to tell you, placebo effect is a physiologic effect. Mm-hmm. And if it works 33% of the times, we should be using more placebo.
Right.
But I think it's even more than placebo. I've seen people respond to acupuncture. I learned acupuncture in the 70s as a joke. I took a course at Stanford University, came back, got 2 interns to come to my office on Wednesday nights. But if it works, it works. And if it doesn't work, all you could say is it doesn't work for me.
Right.
Period.
Right.
So that's why hypnosis, maybe preoperatively to diminish pain or to make the course of surgery easier. It might work, it might not work. Acupuncture, it works. We know physiologically there's something that happens. There's an increase in endorphin levels. And cranial sacral manipulation is wonderful. Massage is wonderful. Life is wonderful.
Right. Yes.
If it's out there, why not try it?
So that's exactly, and all these different disciplines that we offer at the center thanks to these incredible practitioners who volunteer their time.
Right.
So people with cancer can experience these different disciplines and see what makes them feel better. But what you said is very important. So many things we can't prove. We're not going to be able to prove hope, faith, belief,
Right.
intention,
Right.
inspiration.
Right.
So those are things we
That's great.
can't measure the power of the human spirit. We can have some ways to measure indirectly, but this is so important for our colleagues to remember that when a patient believes something is going to help them, that we support them.
Right.
We say, do that because if you believe in it, it's going to help you, and also try these other things.
Right.
But whatever you believe in, we need to support them, because the challenge so many times, for whatever reason, our colleagues may say, well, that doesn't work.
Right.
And that's usually it's done when a physician is busy. They may say, well, let's just focus on the medicine right now. All those things I don't understand.
Right.
The best thing is to say, I don't know about that, but if you believe it and you understand it and you've researched it, use it,
Right.
and I will work on the medicines and I'll support other things you're doing.
In our acceptance of the patient's belief, the patient bonds in belief to us.
Right.
It works.
It works.
Beliefs,
Absolutely.
shared beliefs are key to healing.
Absolutely. And the last thing I want to say, which we've discussed, in the healing environment, when the participants, nurses, physicians, the medical assistants, receptionists, everyone working together in this healing environment, when there's that intent, true, pure, strong intention to help these patients,
Right.
that they feel it, it influences them, and that will be a topic for the next time to talk about. When we focus on something, an observation, the observer
Right, affects the observation.
Right,
You know, Heisenberg in quantum mechanics,
that's it.
the observer affects the observation, and we have to realize we're doing that every single
Time.
moment that we're with the patient.
Yeah,
They're observing us, affecting us, and we're observing them and affecting them.
yeah. So when we just switch and change a little bit our perception on what we're looking at, or looking at a person in a different way, and in a more compassionate way, in a more caring way, when we share that care that we all have, they'll perceive it and it'll influence them dramatically.
Well, thank you.
Thank you.